We're reflecting on where we've been, where we are, and where we're going. Golisano Children's has grown substantially to meet the needs of its expansive 22-county service area. For example, we have a Level 1 Pediatric Trauma Center, the Water Center for Children's Cancer and Blood Disorders, a Pediatric Emergency Department, nationally recognized Cystic Fibrosis Center, Golisano After Hours, the Safe Kids Program, enhanced services for children in foster care, Lead Poisoning Resource Center, and more. They're among a network of services we have to care, restore, and keep children at optimal health. While the majority of children are very well served, we've had a series of focus groups and internal dialogues that have provided insight that more could be done to improve the health and health outcomes for children with intellectual and developmental disabilities. We simply haven't done enough for those children. The unique model of the Upstate Center for Special Needs will meet these concerns, so thank you for your consideration of this funding request.
The focus of my clinical practice is the care of children who have primarily physical disabilities such as cerebral palsy, spina bifida, and children who are blind and deafblind. So when I'm not seeing patients, I'm involved with a number of community initiatives to promote inclusion. One of the major projects we're involved with that we launched here at Golisano Children's Hospital is the Fitness Inclusion Network. This is a cross-institution initiative that promotes inclusion across the age span for people with intellectual and developmental disabilities. Sport, recreation, dance, adaptive design, these are all activities that bring our community together. So the overarching theme here is inclusion and community building. And it's really central to developmental disability care. Community building is central to the care that we provide to our patients.
Our clinic focuses on really family-based treatments for children who have autism, and more specifically, autism with comorbid behavior problems. So the kids we see have behaviors that really limit their involvement in the community, places them at risk to be put in institutions or to be removed from their schools. Our wait list right now for the outpatient clinic is over 100 kids long. If you look at the average length of admission for kids coming here 5 days a week, you're placing kids at about 2 to 3 years out for when they can get admitted. So, put yourself in the perspective of a parent where you've got this kid and the kid starts to display these problem behaviors and you don't know what to do, and you find a place that can help you. But then the place that can help you can't help you for 2 years. How do you even manage that to be able to deal with the stress that much causes and to think, well, what do I do for the next 2 years before these people can see me? The center we're proposing would actually allow us to double our clinical capacity across the board. And so we would be able to see not just the kids who have the aggressive problems, but also the kids in our feeding program and the kids in our medical clinic. If we have this kind of need in the community with the large swath of the community that we serve, then obviously the more providers, the more people we can train, the more kids that we can get into the clinic, the quicker we can deal with the wait list issue and getting kids seen and helped more efficiently. We can do so much more, and we're serving a geographic region that spans from Pennsylvania to Canada. There's a lot more kids that can be served, and there's a lot more we can do with bringing kids in, doing more related to things like telemedicine and ongoing trainings for people, and sending our graduate students out into the community that will really help to foster an environment of this kind of comprehensive care model and really systems-based approach that these kids need. When we open this center and have everything combined, it's going to be the only multidisciplinary center like this in the country. I'm truly not aware of any other program that spans the gap from basic research to clinical programs to education to an inpatient unit. I mean, consider the fact that the inpatient unit alone is going to be only one of 9 in the country. So we're in very rarefied air when we come to this. The closest thing you would get to a program like this is a 5-hour drive away. And a lot of families from this area drive their kids 5 hours away for inpatient care. We shouldn't have to put them in a position to do that if we have all of the relevant expertise here. So when we open the center, we're going to have something that's incredibly unique and that brings the best practices for treating children with special needs all into one place. That's what's going to make it be unique, that's what's going to make it be a cornerstone of Upstate, and that's what's going to make it enhance the good services that we're already providing through the Golisano Children's Hospital.
It gives me great pleasure to announce that Tom Golisano has committed $3 million to create the Center for Special Needs Care.